What's missing with the way America has approached weight loss? You go to your doctor and they say, you really should lose 20 pounds. Or maybe they soften it a little and say, you really could get better control of your medical conditions if you lose some weight. Cut your calories, get more exercise. If you've been there, you know the feeling. You might feel deflated. You've tried that, it hasn't worked. You might feel frustrated. You might even feel hopeless. You may have lost the weight and regained it back over time. Either way, you feel like you're to blame. So what's missing here? Why does this approach miss the mark? It's too bad, but a lot of healthcare providers really don't view obesity as a disease, and a lot of society as well. Let me show you what I mean. I got a report recently from a specialist in my area. He saw one of my patients, and weight loss was part of his treatment plan. So he wrote at the end of the note, lose 20 pounds, follow a 1,500 calorie diet, and exercise at least 150 minutes a week. Society actually has this same concept. If people with obesity will just eat less than they burn, they'll lose weight. The mathematics should work out. For people with obesity, medical studies actually tell a different story. They show that about 50% of people can lose about 5% of their body weight with a diet and exercise program. So for 250 pounds, that's about 12 to 13 pounds. These are well-supported studies where people are actually following the recommendations. They're actually following the diet and they're doing the exercise. So people are actually not losing the weight that we would expect them to, based on the mathematics. My experience with my patients is the same. I see a lot of people trying to lose weight. They're working hard at the diet, they're working hard on exercise, and they're not able to lose very much weight. But again, these are people with obesity who struggle to lose weight or to keep their weight loss off. And because of the way that people approach them, either their doctors or the rest of society, and put the blame on them for not being able to lose the weight, a lot of them also feel the self-blame. They've taken that same mindset. So they come to see me and they say something like, I should really be able to do it. I'm sorry, doctor. I keep trying and I keep failing. And they've taken the mindset of self-blame, but they're still losing inadequate weight. But it's the same weight that we would expect based on what we see from the medical studies. Healthcare providers and the rest of society are often passing the blame on the patient for not being able to be successful with their weight loss. And I see the patients taking this attitude for themselves too. A lot of them are blaming themselves for not being successful, either in weight loss or keeping the weight off. Either way, telling people to eat less and exercise more really is not enough. Let me make a comparison to a well-known disease, just to show you what I mean. So let's take high blood pressure as an example. We all know that high blood pressure is a bad disease. Left uncontrolled, it leads to heart attacks, strokes, kidney damage, other heart damage, and other problems in the body. It's a complex interplay between how our body controls its blood vessels, fluid balance, salt balance, and other hormones. So we all recommend lifestyle changes to treat the disease and also medications if needed. There actually may be things that you are doing to make your blood pressure worse and don't even realize it. Maybe what you're eating, it may be what you're doing in your free time, it may be anything else that you don't know about. And there may be things that we need to do to treat that, whether it's lifestyle changes or medication or otherwise. Either way, we all agree that high blood pressure is a disease and needs to be treated. So when we give recommendations, not only are we recommending lifestyle changes with diet and exercise, but we'd recommend something for medication too, if that's needed. But here's the interesting point. When we recommend exercise and diet, we're telling our patients that this may not work well enough to bring your blood pressure down all the way. Let's say someone's blood pressure is 20 points too high. Diet and exercise is proven to lower blood pressure about 4 to 5 points. And beyond that, most people need medications or some bigger lifestyle change. The key point is that we're treating high blood pressure as a disease. We're giving lifestyle advice for diet and exercise, and we're providing other treatment recommendations too. Medications or even invasive procedures for some. And insurance covers these treatments like they would any other medical disease too. Now, what would happen if we treated high blood pressure the way we treat obesity? You might hear something from your doctor like, you really should drop your blood pressure by 20 points. And then you'd get some advice on diet, something that works for high blood pressure, and exercise advice. But would he tell you that it's only estimated to drop your blood pressure 4 to 5 points, when really you need to drop your blood pressure 20 points? What if he doesn't tell you there's medication options? What if he doesn't do the right testing for looking for other complications from that disease? It would really be opposite of the way we treat high blood pressure now, or any medical disease, which really is what's happening to how we treat obesity. So let's look more at how we're treating obesity in healthcare and in our society. And I'll tell you, it's all wrong. We're giving people advice to lose weight. We're telling them to follow a specific diet. We're telling them to exercise. But we're not telling them that it only leads to a small amount of weight loss in a lot of people. Now, of course, there are some people who lose a lot of weight, and those are the outliers. And of course, people with obesity have a much different response than people without. And then when they don't lose the weight, we're allowing them to take the blame, and we're actually passing blame on them whether we explicitly say it or just imply it. And most insurance companies don't even cover the cost of treatment. So most people have to pay extra out of pocket. This mindset's really been around for centuries, if not longer. And it's really the basis for our political policies, our community programs, and the way we treat and interact with other people with obesity. So what's missing in the way America's approaching weight loss? First of all, we really don't have the right mindset. We need to have the mindset that obesity is a disease. And second of all, we need to provide real treatment recommendations. We're not providing enough hope for people who really need treatment. And third, we really need insurance coverage to cover the cost of treatment. So what if things were to change? What if we reframed our mindset and started thinking about obesity as a disease? It would be a much different experience for people going in seeking care. You might hear something like, I want you to know that there's treatment options for obesity. There's programs that can help you get past bad habits, change behaviors, start working on dietary changes, learn how to cook good food, learn how to make meal plans that stick with your calorie goals, learn how to get on a regular exercise program, and even help to get through the pain that you might have because of the obesity. There's medication options that can be very effective for a lot of people. And there's even surgery for people who qualify. And best, insurance covers these treatments just like they would any other medical condition. And if you don't lose weight initially, we'll stick with you and help support you through this, because we know that there's a complex interplay of how society and family and personal issues interact with what's going on with weight loss. And so we don't blame you when you come in and haven't lost any weight. I think that would change the landscape completely. And that's really what my mission is here. My mission is to show people that there are treatment options for obesity. And it's not just diet and exercise alone. It's much more than that. So subscribe to my channel. Follow me for more content coming. Thanks for listening.